We've covered a lot of magnesium-related topics on this channel, its benefits for sleep, heart health, anxiety, and more, but somehow we've overlooked one of the most important topics, until today. Magnesium glycinate is one of the most popular supplements for seniors, but did you know it can interact with certain medications in ways that could be risky, or even dangerous? In this video we're going to break down 6 classes of medications you need to be careful with. Some of them you can safely take a few hours apart, while others you might need to avoid completely. Make sure you stay until the end, because we'll start with the medications that cause the least dangerous interactions and work our way up to the ones that could be potentially the most dangerous. But before we dive in, please hit that like button and subscribe to the channel. This helps the video reach more seniors who can benefit from this life-saving information. 1. Thyroid medications. Many seniors take thyroid medications to manage conditions like hypothyroidism, where the thyroid gland doesn't produce enough hormones. The most commonly prescribed medications include levothyroxine, often sold under brand names like Synthroid, Euthyrox or Levoxyl, and sometimes liothyronine, known as Cytomel. These medications are highly sensitive to absorption in the gut, and even small changes in how your body absorbs them can significantly affect your hormone levels. Magnesium glycinate can interfere with thyroid medications because it can bind to them in the digestive tract, forming a compound that your body cannot absorb efficiently. This means that even if you take your medication, less of it actually reaches your bloodstream. The consequences of this reduced absorption can be serious. Lower hormone levels may lead to fatigue, weight gain, brain fog, constipation, and even heart palpitations, all symptoms that can significantly affect the quality of life for seniors. Science supports this interaction. A study published in the Journal of Clinical Endocrinology and Metabolism showed that minerals such as magnesium, calcium, and iron can significantly reduce the absorption of levothyroxine when taken at the same time. The American Thyroid Association also advises spacing mineral supplements at least 4 hours apart from thyroid medications to prevent absorption problems. To take thyroid medications safely while still benefiting from magnesium glycinate, it's important to focus on timing. Thyroid medication should be taken first thing in the morning on an empty stomach with water, and magnesium should be taken at least 4 hours later. Consistency is crucial, so taking your thyroid medication at the same time every day and maintaining that separation from magnesium helps keep hormone levels steady. If you notice symptoms like fatigue, brain fog, or unexpected weight changes, your doctor can check your thyroid levels and adjust your timing or dosage if needed. 2. Antibiotics. Many seniors take antibiotics to fight infections, from urinary tract infections to respiratory illnesses. Common antibiotics that can interact with magnesium include tetracyclines like doxycycline and fluoroquinolones, such as ciprofloxacin and levofloxacin. These antibiotics are very effective when absorbed properly, but magnesium glycinate can interfere with their absorption in the digestive tract. When magnesium binds to these antibiotics, it forms a complex that your body cannot fully absorb, which can reduce the effectiveness of the medication. This interaction is not just theoretical. Research has shown that taking magnesium or other mineral supplements at the same time as tetracyclines or fluoroquinolones can significantly decrease the amount of antibiotic your body absorbs. If the antibiotic isn't absorbed well, the infection may not be fully treated, and this could lead to prolonged illness or even antibiotic resistance, which is particularly concerning for seniors who may already have weaker immune systems. The good news is that this interaction is usually easily managed by timing your supplements carefully. The general recommendation is to take antibiotics either 2 hours before or 4 hours after magnesium supplements. By giving your body this separation, you can ensure that the antibiotic is fully absorbed and remains effective while still benefiting from magnesium glycinate. 3. Diabetes medications. For many seniors, managing diabetes involves medications like insulin or oral drugs such as sulfonylurias, including glipizide and sometimes metformin. While these medications are essential for keeping blood sugar under control, adding magnesium glycinate into the mix can have both benefits and potential risks. Magnesium is known to improve insulin sensitivity, helping the body use insulin more efficiently, which is generally a good thing, but it can also amplify the effects of diabetes medications if not monitored carefully. When magnesium enhances insulin sensitivity, it can occasionally cause blood sugar to drop too low, a condition called hypoglycemia. Symptoms can include shakiness, dizziness, sweating, confusion, or even fainting, issues that can be particularly dangerous for older adults. Research supports magnesium's role in blood sugar management. A study published in the Diabetes, Obesity, and Metabolism Journal found that magnesium supplementation significantly improved fasting blood glucose and insulin sensitivity in people with type 2 diabetes. While this benefit is encouraging, it highlights the importance of monitoring blood sugar closely when combining magnesium with diabetes medications. The safest approach is to take magnesium glycinate at a consistent time each day and track your blood sugar levels. Always discuss supplementation with your healthcare provider, who may adjust medication doses or recommend more frequent blood sugar checks to prevent hypoglycemia. 4. Proton pump inhibitors. Many seniors take proton pump inhibitors or PPIs such as omeprazole and esomeprazole to manage acid reflux, heartburn, or stomach ulcers. While these medications are effective at reducing stomach acid, long-term use can make it harder for your body to absorb magnesium. That's because stomach acid is necessary for your intestines to fully absorb magnesium, so taking PPIs may actually undo the benefits of magnesium glycinate supplementation, whether you're using it to correct a deficiency or maintain optimal levels. This interaction is particularly important for seniors, since magnesium supports heart health, muscle function, and nerve signaling. If you rely on magnesium supplements to stay healthy, taking PPIs at the same time could reduce their effectiveness. The best approach is to discuss your medications and supplements with your healthcare provider, who can help you figure out the best timing or alternatives to ensure you get the magnesium your body needs. Sometimes you may need to discontinue PPI use in order to fully maintain the needed magnesium levels. 5. Heart medications. Using magnesium glycinate with certain heart medications can be outright dangerous for seniors. Common medications that may interact with magnesium include digoxin, beta blockers like metoprolol or atenolol, and calcium channel blockers such as verapamil or diltiazem. Magnesium plays a role in regulating heart rhythm, and when combined with these medications, it can sometimes amplify their effects, potentially causing serious changes in heart rate or rhythm. For example, digoxin is a medication used to strengthen the heart's contractions, but too much magnesium in the bloodstream can interfere with how digoxin works, increasing the risk of dangerous heart rhythm disturbances. Similarly, magnesium can enhance the blood pressure lowering effects of beta blockers and calcium channel blockers, which may cause excessively low blood pressure or a dangerously slow heart rate in some seniors. These interactions are particularly concerning because older adults are more sensitive to changes in heart rhythm and blood pressure. Research supports these cautions. Clinical studies have shown that magnesium levels need to be carefully monitored in patients taking digoxin, as imbalances can increase the risk of toxicity. Seniors taking heart medications, especially those with impaired kidney function, are at the highest risk, and any supplementation should be carefully coordinated with a healthcare provider. The safest approach is to never start magnesium supplementation without consulting your doctor if you are on heart medication. Your healthcare provider can guide you on whether magnesium glycinate is appropriate, what dose to take, and how to monitor your heart safely. 6. Diuretics. Perhaps the most dangerous combination you can make as a senior is taking magnesium glycinate alongside certain diuretics without proper guidance. Diuretics, often called water pills, are commonly prescribed to manage high blood pressure, fluid retention, or heart failure. They come in different types, including loop diuretics like furosemide, thiazide diuretics such as hydrochlorothiazide, and potassium-sparing diuretics like spironolactone. Each type affects magnesium levels in the body differently, which can make supplementation tricky. Loop and thiazide diuretics can cause the body to lose magnesium through urine, increasing the risk of deficiency. At first glance, taking magnesium supplements alongside these medications might seem helpful, but without careful monitoring, there's still a risk of imbalance, especially if doses are inconsistent. On the other hand, potassium-sparing diuretics reduce magnesium excretion, so taking magnesium supplements on top of these drugs can lead to excessively high magnesium levels, which may cause symptoms like dangerously slow heart rate, low blood pressure, muscle weakness, or even cardiac complications. Research highlights the importance of caution. Studies in older adults have shown that magnesium imbalances, whether too low or too high, can significantly impact heart rhythm and muscle function. Because seniors often take multiple medications and may have reduced kidney function, the risk of complications is higher than in younger adults. The safest approach is to always consult your healthcare provider before combining magnesium with any diuretic. Your doctor can help determine whether supplementation is needed, the correct dosage, and how to safely monitor magnesium levels, particularly if kidney function is impaired. So, there you have it. 6 classes of medications that seniors need to be especially careful about when taking magnesium glycinate, from thyroid medications and antibiotics, to diabetes drugs, PPIs, heart medications, and diuretics. Each one carries its own potential risks. The key takeaway is this: magnesium glycinate can be incredibly beneficial for heart, muscle, nerve, and overall health, but if you're taking any of these medications, it's essential to do so safely. Always talk to your healthcare provider before starting magnesium, and make sure they know about all the medications and supplements you take. This way, you can protect your health while still reaping the benefits of magnesium. If you found this video helpful, please hit that like button and subscribe to the channel so more seniors can learn how to stay healthy and avoid dangerous interactions. And don't forget to share this video with friends or family who are taking magnesium or these medications. It could make a real difference in their health. Thanks for watching and see you in the next one.